So what we have discussed in the last class, finish. Temporary and permanent. Complete contraceptive method is done. Yes. What we will do now? MTP you want me to do? Yes. So a very small topic in your third chapter, reproductive health. One or two more question can be asked from this topic, that is MTP, medical termination of pregnancy. Medical termination of pregnancy, or this MTP can also be called, it can also be called as induced abortion. Yes. So when we talk about MTP, medical termination of pregnancy, it is also called as induced abortion. So this MTP was legalized in India. In India, it was legalized in 1971. Done? Yes. So here, this MTP is safe till first trimester. That is how many weeks? 12 weeks. After 12 weeks, okay, till 24 weeks, it can be performed, but it is risky for both mother and fetus. One second. ರಿಜಿಸ್ಟ್ರೇಷನ್ ಪ್ಲೇಟ್ ನಂಬರ್ ಬುಕ್ ಮಾಡೋದಲ್ಲ Yes. So, medical termination of pregnancy, it was legalized in India, but the condition arises on what basis it was legalized, right? So here, two conditions. Number one, it should be a rape case. Okay, it should be a rape case. Or number two, very important, if the pregnancy is continued, okay, that time it should be risky for the baby or for the mother or for both. In these two conditions, it is implemented, it is allowed, it is legalized by the government of India. But later it was seen usually the people of India, they opt for amniocentesis test. This is the test through which the chromosomal pattern of the amniotic fluid will be studied. They get to know whether the chromosomal pattern is XX or XY. After knowing if it is XX, they try to abort. Okay? So in that case, no, the number of in 1900s, 1990, okay, the number of cases increased for killing female feticides. So from that time, the amniocentesis test was banned. Okay, in India, it is not allowed, and condition is implemented. Two condition: if it is unprotected sex or rape case, okay, and that conceiving is a problematic case for the child as well as the mother, okay, in that case it is allowed, otherwise it is not allowed, okay, until when it is safe, until 12 weeks properly it is safe, okay. After 12 weeks also it is performed, okay, till 6 months also mtp can be performed, but there the complete development of the embryo will be finished, okay. 5 months, in 5 months the complete embryo development is over, okay. After 5 months till 7 months maturity level is going on, movements starts, okay, the movements of the baby starts and maturation of the embryo is going on. So in that phase also, if there is any risky, okay, thing that has happened, for example the umbilical cord is tied within the neck of the baby, or the waste material of the mother is being swallowed by the baby, and that will lead to many complications further. In that conditions mt can be performed, okay, mtp will be performed. So otherwise till 3 months it is safe, after that it is risky for mother as well as the baby. Done. Yes, one or two more question will be asked related to mtp. Yes. Now next, very important topic we have STIS. STIS. What is this STIS? Yes, sexually transmitted, sexually transmitted infections, sexually transmitted infection. If it is STDs, it is sexually transmitted. If it is DS, it is diseases. Okay. So we use the word both. Infection, why? Because multiple symptoms are seen. Therefore, we call it as infection. And when we tell sexually transmitted, it is not one disease. One organism is not involved, one disease is not involved. Okay. Many organisms are involved. It can be a bacteria, it can be a fungi, it can be a virus, and multiple diseases occurs. Right? So this STIS is also called as reproductive reproductive tract infection. It is also called reproductive tract infection, RTI. Or this can also be called as venereal disease, VD. Yes. So here, first and foremost, when we talk about STIS, what we should know: mode of transmission. Mode of transmission. Mode of transmission. Number one. Right? So here, this STIS or STDs will be transmitted by sex with unknown partners or with multiple partners. Point number one. Number two, the needles, syringes, blades, and other surgical equipments used by infected person can also lead to STIS. Point number three, taking drugs intravenously directly to the veins. One person have taken the drugs, no, from the same syringes. If the another person is taking the drugs, if one person is infected, that infection will be easily transferred to the another person. Then apart from that, it can be easily transmitted. This STIs can be easily transmitted from infected mother to fetus, the developing baby, developing embryo, no, it will be easily transferred. So okay. Yes, what, which point? Oh. No, that is surgically. One more point you can add there. Right? You can add for blood transfusion through blood transfusion. No, giving blood to other. If one person is affected, no, now this person is giving blood to another person, then also the transmission, blood and blood product transfusion also can. This point is different, this point is different. Okay, whatever the needles, whatever the syringes, blades that is used in the surgery, no, if any operation is going on, surgery is going on, if one person is infected, same equipment is used, no, without the cleaning or without doing the sterilization, if the same is used, no, definitely within seconds, within short span of time, that will be easily transferred to the healthy person. Yes. Third point, taking drugs intravenously. Hello. Taking drugs intravenously, no, as I told you, if one person is infected, no, that person knowingly or unknowingly taking the drugs, no, syringe is inserted, no, intravenously drug is used, right? So that syringe, if the next person, friend of that person is inserting directly, he is not inserting the drug, he is inserting the disease. Okay. Yes. So these are the few mode of transmission through which the STIS or STDs or VD or RTI will be transferred from one person to another. Transmission will take place. So the question arises, sir, when we tell STIS, what exactly is this STIS? Which organism is responsible for this? No? So here, when we tell STIS, sexually transmitted infections, it is not one. There are many diseases that comes under this category. Number one, we can take syphilis. Syphilis. Number two, gonorrhea. Number three, yes. All right. Number three, genital herpes. Number four, genital warts. Number five, calmydiasis. Number six, hepatitis B. Number seven, AIDS. Yes. See, AIDS is disease. What is AIDS? Acquired immunodeficiency syndrome. Yes, acquired deficiency syndrome. Okay. So here complete immune system will be affected. So we will tell acquired immunodeficiency syndrome. Who is causing AIDS? The virus called HIV. Okay, HIV is the virus. Human immunovirus. It is a virus. And see, this AIDS acquired immunodeficiency syndrome, we are not using the word disease here. Right? We are not using the word disease. We are using the word syndrome. Why? Multiple organ dysfunctioning. A person suffering from this disease AIDS will have multiple organ dysfunctioning. Multiple organ damage will be seen. Is that clear? He will be suffering from the heart, lungs, kidney, multiple organ failure. Is that clear? Totally the immune system of the human will be affected here. So for that reason, we are not calling it as disease, we are calling it as syndrome. Done? Yes. So here, this all these diseases together, no, we are using one word, that is STIS or STDs. No. So here, you have heard about syphilis. Syphilis. No. Yes. So again, this syphilis is the bacterial disease. It is caused by the bacteria called Treponema pallidum. It is called Treponema pallidum, a bacteria by name Treponema pallidum. Maximum all the diseases, no, they cause infection, no, in the reproductive tract, nearby to the reproductive tract only. Yes, the genital part will be affected. Second, we have gonorrhea. This is also a bacterial disease caused by bacteria, that is Neisseria gonorrhea. Yes. Number three, genital herpes. This is caused by virus. A virus by name herpes simplex virus. Herpes simplex virus. Then genital worth, again caused by virus. Human papilloma virus. Then calmaidiasis, actinomycetes, or a fungi by name calmaidia. Hepatitis B by hepatitis B virus. Yes. So all these diseases together are called as STIs. These are caused by two modes. Okay, one, it can be transferred. This disease is transferred from one person to another through unprotected sex with the unknown partner, sex with the multiple partner, with the deceased partner. Is that clear? Number two, it can be accidentally by blood transfusion. It can be by syringes, usage of syringes, blades, cutters, surgical equipments, unknowingly from one person to another. Apart from that, if the mother is infected, it will be definitely transferred to the fetus also. Done? Yes. So here, in these diseases, no, syphilis, gonorrhea, genital herpes, genital birth, chlamydiasis, hepatitis B, AIDS, all these diseases, no? So here, syphilis, gonorrhea, genital birth, chlamydiasis, these diseases can be cured. it, it can be treated or cured if it is diagnosed in the first stage. If the primary treatment is given, if it is diagnosed in the first stage itself, no, before the multiplication, before the infection spreads, if this is seen, no, that time these diseases are treated, cure is present. Is that clear? But when we talk about genital herpes, hepatitis B, and AIDS, these three are not cured. Permanent treatment cannot be performed. ठीक है? Only prevention, 4 stages. ठीक है? 4 stages. If it is in the first stage, it can be diagnosed easily. What are the symptoms? What are the symptoms through which we can diagnose this, sir? As I told you, basically the function starts in the reproductive tract, reproductive system of the male and female. The pelvic region will be affected. Okay? Because of that, we will also called as pelvic inflammatory disorder or pelvic inflammatory disease. Okay? Itching sensation, burning sensation, okay? A small inflammation, redness, swollenness can be seen in the genital part, in the private area. Number one, this is the first symptom. If this symptom, if this symptom is diagnosed in the early stage, that can be cured. If it is not treated, if it enters into the second stage, third stage, or final stage, it cannot be cured. Okay? So permanent cure is done for syphilis, gonorrhea, genital birth, chlamydiasis. These diseases have treatment. Okay? It can be cured. When we talk about genital herpes, hepatitis B, and AIDS, here permanent treatment is not present. Permanent cure, once it is happened, once this disease has occurred, no, so it is not cured. Prevention can be done. Cure is not present, only prevention can be done. Is that clear? Yes. क्या बेटा? Cancer इसमें नहीं आता. Cancer is not the sexually transmitted disease, no? No. Every disease, okay, every disease, it will have either 3 stages or 4 stages. वो भी 4 stages रहती है. 4 stage, final stage is 4th stage. हाँ, वैसा नहीं है. Now with many different treatments, it can be treated till 4th stage also. ठीक है? Different treatments, chemo कराती. It can be done by chemo or radiations. Depends where it is present. अगर oral है, नहीं, oral cavity में है, that time radiations can be done. X-ray. ठीक है? It can be by radiation therapy. Radiotherapy कहती है हमें. If it is other cancers, ठीक है? It can be ovarian cancer, cervical cancer, uterine cancer. ठीक है? That time they go for chemotherapy. ठीक है? Chemo, chemicals. One more option we have, immunotherapy. There we are not treating the disease. There we will try to boost our immune system. Okay? When our immune system is strong, it will fight back. So that therapy is called immunotherapy. There are different therapies. One more technique we have, alpha interferon therapy. So that alpha interferon is a protein that we will use to treat the cancerous cells. Different treatments are there. Okay? And this disease, क्या हुआ? Menstrual cycle, I'll do it. Did you understand? Yes. So, what are the symptoms we see in this disease? As I told you, number one, in the genital region, no, pelvic region, itching sensation, burning sensation, small redness, swollenness, okay, lump-like structure, or inflammation will be seen. This is primary one. Okay. If it is major symptoms, no, major symptoms, first and foremost in the females, asymptomatic symptoms नहीं दिखते इसमें. ठीक है. Finally it will lead to, if the woman is pregnant, no, that time it will opt for two things. ठीक है. एक ectopic pregnancy, दूसरा है ना stilt birth. What is that ectopic pregnancy? If the woman is suffering from STIs, no, that time the pregnancy will not continue normal. After the fertilization of the ovum in the fallopian tube, that ovum has to come down, right? Once the fertilization is over, that zygote has to undergo cleavage. It has to move down. 2n say 4n, 8n, 16n, then blastomere cell, right? Blastula, marula, gastula, then finally it has to reach and attach in the form of blastocyst to the uterus, endometrium layer. This will not happen if STIS is present in that woman. Okay. What happens, sir? Infection is present. The ovum will not cross the isthmus junction. It will be present in the fallopian tube only. So for two weeks, 3 weeks, it will be present, and finally that will be released out. Is that clear? Pregnancy will not continue. That is one case. Second, we have silt birth. This is ectopic pregnancy, I told you. Okay. Second, we have stilled birth. What is that stilled birth? So usually the baby will be died inside only. So the delivery will be given to, abortion will be done for the died baby. That is called stilled birth. This will happen because of the infection that is present in the mother. STIS infection. Is that clear? These are the few symptoms. So to avoid this, what can be done? What are the preventive measures? No, we should avoid sex with the unknown partner, multiple partner, unprotected sex. Okay. Number two, when we take the blood transfusion, if necessary, that has to be tested. Is that clear? The donor who is giving the blood, no, that we have to see whether he is healthy person, and we need to check the blood before transfusing to the another person. Okay. Number three, usage of syringes, used syringes, blades, cutters, knives, needles, that has to be totally avoided. Okay. No drug or nothing should be intravenously used that is used by the another person. These are the few things to avoid the infection. STIs, sexually transmitted disease. Okay. One, through sex it is transmitted. Other, by the other things which are used in the day to day life, right? That also can cause the infection to transfer from one person to another person. Done? Did you understand? Yes. So any doubts you have in this? No. What is MTP? What is STIS? क्या मैडम? माइक ऑफ है? ऑन है ना? क्या दिख रहा है? प्लेन दिख रहा है क्या? कौन है? ऑनलाइन नहीं है अब. Yes. Uh, Apart from that, we have one more topic, that is infertility. Shall we proceed with that? After that, I'll go with menstrual cycle. Done? Yes. Huh? That is only. We should start with infertility, no? What is the procedure for infertility? ART. Yes. So here, infertility. Yes. So if I ask you what is infertility, what will be your answer? Yes. Unable, unable to produce own young ones in spite of having unprotected sex cohabitation by couples. Okay? It's a condition where a couple is unable to produce their own young one. So this infertility can be caused by many reasons. It can be because of physical, physiological, congenital. It can be by drugs, habits. So because of this n number of reasons, a person can become infertility. Infertility can occur by birth also. Okay, it can happen after birth also. Is that clear? So here, this infertility can be caused by few reasons, that can be physical, physiological, congenital, drugs, habits, diseases, etc. Yes. So these are the few reasons because of which the couple is unable to produce their own young ones. This condition in a couple is called as infertility, where a male partner or a female partner or both are infertile. If they are infertile, they cannot produce their own young one. So because of this reason, physical, physiological, congenital, drugs, usage of drugs, habits, diseases, it can lead to infertility. Yes. So if this condition is seen in the couples, they have to opt for A or T. Assisted reproductive technology. So here we can tell assisted, or we can use the word artificial reproductive technology, through which the infertile couples can also have their own young ones. Done. What are the techniques? Number one, we have IVF ET. Number two, ZIFT. Number three, GIFT. Number four, IUT. Number five, IUI. Number six, AI. And number seven, ICSI. Okay? Yes. So here, number one, IVFET. Can you expand this? Anyone? Yes. In vitro fertilization. And ET stands for embryo transfer. Yes. See. So in vitro fertilization is a process where the fertilization of male and female gametes take place outside the body of the female. Okay? Assume in the laboratory, in the test tube, if this fertilization is performed by taking male and female gametes, then it is called as in vitro fertilization. Once the fertilization is over, development starts. No, that time also insertion can be done. Okay? Or if the complete development is proceeded in a test tube itself, okay, just by increasing the size of the test tube, micro, from the micro level to macro level, and finally to the tub. Okay, fish tank आता नहीं, वैसा tub like structure. If it is continued and complete development is done in the tub itself, that program is called as test tube baby program. It is called test tube baby program. Is that clear? Otherwise, if the embryo, till the development of embryo is done, then it is transferred. It is called ET, embryo transfer. Yes. Then number two, we have ZIFT, zygote intra fallopian transfer. Zygote intra fallopian transfer. Yes, zygote intra fallopian transfer. So here what we are doing, we will take the male and female gametes, male gametes, female gametes, and this male and female gametes will be fertilized outside. No, so here N cell together becomes 2N cell. No, that is the formation of zygote. So once this zygote is formed, that zygote will be inserted into the female, no, fallopian tubes of the female. Yes. Did you understand? That is zift. Then assume gift gamete intra fallopian transfer. Yes. Now, if you assume what is the difference between zift and gift? Yes. Why to opt for zift and when to opt for gift? Yes. No idea. Hmm? See, zift zygote intra fallopian transfer is done if the fallopian tube in which the ovum is present not allowing it to fertilize. If there is any infection in the fallopian tube, okay, and there is no fertilization occurring, zygote formation नहीं हो रहा है, ठीक है. So because of that reason they are opt for zift zygote intra fallopian transfer. We are taking the ovum outside, we are taking the sperm, okay, in the laboratory level we are trying to fertilize, then we are inserting the zygote, that is zift. Okay, gamete intra fallopian transfer assume because of n number of reasons. Okay, it can be by genetic, it can be by chemical hormonal changes in the body of the female. If the ovum, no, if the ovum is not reaching the ampulla region, the menstrual cycle is going on, but because of any reason the ovum is not coming out after ovulation to the fallopian tube. Now in that condition what can be done, we can take the ovum from the ovary outside, okay, then directly when we insert the ovum into the fallopian tube, we are not fertilizing, we are directly inserting the gamete into the fallopian tube. Then if the sperm directly fertilizing the ovum, that condition is called gamete intra fallopian transfer. If we insert the gametes, it is gift. If we directly fertilize and insert the zygote, it is zift. Did you understand? Yes. Then IUT intra uterine transfer. No, if the transfer is done through uterus part, no. So here usually what happens in the normal condition, from the ovary the ovum will reach the fallopian tube, and from the fallopian tube the sperm will reach the fallopian tube and fertilization will take place in the ampulla region of the fallopian tube. After fertilization, the zygote formation will take place and it will come down. It will move and reach the uterus part. This is normal condition. But here in this condition, what we are doing, already we have fertilized the egg. Formation of zygote have taken place. Now that zygote, after the formation of cleavage, it can be 2n cell, 4n cell, 8n, 16l, or blastocyst. When we insert that from the uterus to reach the endometrium layer for the attachment, that condition is called as intrauterine transfer. We are transferring to the uterine. Is that clear? Then IUI, intrauterine insemination. Here again, the insemination is nothing but the transfer of male gametes to the uterus part. Then we have AI, no, artificial insemination. Artificial insemination. So here, what is this artificial insemination, sir? Assume, no, this condition can occur both in the male as well as in the female. Assume if the male is unable to produce sperm, unable to transfer the sperm, okay, what we are doing, we will take the sperm from the donor. We will take the sperm from the donor. Or if he is healthy, able to produce the sperm, but the sperm does not have motility, okay, it is not able to reach the uterus part to reach the fallopian tube and fertilize, motility nahi hai, movement nahi hai, in that condition we will go for artificial insemination. We will try to mate the sperm and ovum artificially outside, okay. Yes. How? With the condition, that is ICSI. Here what we are doing, directly the sperm will be injected into the uterus part, intra cytoplasmic sperm injection. So these are the few techniques. Number one, IVF ET. Number two, ZIFT. Number three, GIFT. IUT, IUI, AI, and ICSI. Okay? Multiple choice questions. Fill in the blank. They can ask you. Anyone can be asked. Done. MTP, STIS, this ART. No, all these three are very important topic. Many questions are repeated again and again in the test exams continuously. Yes, you should be familiar with these topics. Done? Yes. Shall I erase? Now, you are having doubt in menstrual cycle. Yes. Menstrual cycle. So, if I ask you define menstrual cycle, what will be your answer? How will you define menstrual cycle? Yes. Hmm? No idea. You can't define. Yes. There is no issue of laughing, no? उसमें हंसने का क्या भी नहीं है ठीक है it is natural. It's a natural process which Almighty has given to you. You should be aware of this. If your menstrual cycle is normal, that means you are healthy woman. You will be healthy. So you should have the knowledge of this. Yes. Tell me. Yes. We can tell menstrual cycle as the cyclic changes of ovary and hormones seen in a reproductive span of women. Okay? The cyclic changes which are taking place, or the event of cyclic changes that take place in the phase of reproductive. Three phases comes in our life. First is juvenile phase, second is reproductive phase, third is senescence phase. Okay? So after juvenile phase, the individual will reach maturity. At start of reproductive phase happens. This phase continue till the age of 48 to 50 years in the woman, and till the age of 50 to 60 years in the males. Okay? If a male is healthy, he can undergo fertilization till 70 also. ठीक है 70 years तक भी he can produce his own young one. But for female, ठीक है, so here 48 to maximum 48 to 50 years. Yes, so here this menstrual cycle starts in the females at the age of puberty. It will start from the age of puberty, and this puberty age starts 8 to 12 years. In between 8 years to 12 years of the female life. Done. For the first time when this menstrual cycle starts, no, it is called as what? It is called menarche. Okay? And each menstrual cycle will run for the days 28 days or 29 days. Done? Yes. And this cycle, assume it is started at the age of 12, it will continue. It will continue till the age of 48 years to 50 years. Okay? And in this phase, stoppage happens. Stoppage of menstrual cycle. No, when it is stopping, it is called as menopause. Done? Yes, can you please mute? Did you understand what is menstrual cycle? We know. Okay, what is the start of menstrual cycle called? What is the stoppage of menstrual cycle called? Three things we have studied now. Done? Yes. Now, when we are talking about the menstrual cycle, we need to study the phases of menstrual cycle. Phases of menstrual cycle. Number one, menstrual phase. Number two, follicular phase. Number three, ovulatory phase. And number four, luteal phase. These are the four phases of menstrual cycle. Yes. Number one, first coming to the menstrual phase. In this phase, the major part which happens, right, that is shedding, shedding or breakdown of endometrium layer of uterus. What exactly happens? Shedding or breakdown of, yes, the fluid which comes out, that is not blood. Okay? In the woman's, it is not blood. It is the endometrium layer which mix up with the blood vessels, which will mix up with the blood vessels and releases out as the fluid. This phase is also called as bleeding phase, and this will run for 3 to 5 days in females. Okay? Start of menstrual cycle occurs with the shedding of or breakdown of endometrium layer of the uterus, where bleeding or discharge of fluid takes place. It will run for 3 to 5 days. In few women, if the immune system is strong, if the immune system is strong, okay, so within 1 or 2 days the bleeding will stop, and pain also is very little. Okay, if your immune system is weak, then menstrual pain, cramps, it is common. Okay, apart from that, bleeding will occur for 3 to 5 days. Is that clear? Yes. This is the phase called menstrual phase. Done? Yes. So, another word we can use for this is menses. We can use the word menses or mensuration also you can tell. Menstruation. Okay? Menses or menstruation is the first phase of the menstrual cycle where the bleeding occurs. Okay? Shedding down of, breaking down of endometrium layer of the in the uterus mix up with the blood vessels and discharges or releases in the form of fluid, red fluid. Done? Number one. Coming to the number two, follicular phase. No? Very big phase. क्या बेटा रब कर डालो. Yes, second phase, a very big phase, follicular phase. Yes, to understand this follicular phase, we need to understand the structure of ovary. Okay, when you understand the structure of the ovary, it is easily possible to understand what is happening in the follicular phase. Yes, if you recall the structure of the ovary, yes, no. So here, before the delivery of the female baby, okay, female feticide is present inside the mother wombs. Okay, from that time itself the ovary starts producing follicular cells. It will have follicular, that is not follicular cells, they are called as oocytes. They are called as oocytes. Okay, they are called as oocytes. So when this oocyte, see, when this oocyte is covered by membranous layer, no, then it becomes a follicular cell. It will become follicular cell. So here it will be in millions. It will be in million before the girl baby is delivered. No, the ovary of the girl baby has produced millions of oocytes. For example, 10 lakh oocytes are produced. Done? Yes. Once the delivery of the baby is over, no more cell division will take place, no more continuing of the follicular or oocyte cells will take place. Okay? Done? Now, from the day one till the girl baby reaches maturity, that is puberty, no, the number of follicular cells reduces. From that 10 lakhs or 8 lakhs or 6 lakhs, continuously it will reduce and reaches up to 60,000 to 80,000 follicular cells. Okay? At the time of maturity or puberty, okay, 8 years to 12 years, no, finally the ovary will have how many? 60,000 to 80,000 follicular cells. Okay? Now, once puberty is reached, menstrual cycle starts. Menstrual cycle will start. So once the menstrual cycle starts, in this 60,000 to 80,000 follicular cell, one lucky follicular cell, no, one lucky every month, one lucky follicular cell will enter into menstrual cycle. Okay? Now see, this oocyte or follicular cell, no, one lucky from this, they are thousands of microscopic oocytes which are present, right? So one lucky follicular cell starts growing. It will get converted to primary oocyte, secondary oocyte, right? So primary oocyte will get converted to primary follicle, secondary oocyte will get converted to secondary follicle. Done? Now again this secondary oocyte, no, so will finally get converted into Graphian follicle. Yes. See, menstrual cycle when it is starting, at one side menstruation is taking place. Ne? Where it is taking place? It is taking place in the uterus part. Ne? Here endometrium layer was involved there. Ne? At the same time, in the ovaries, follicular phase starts. Okay. For to start with the conversion of the primary oocyte to secondary oocyte, primary follicle, secondary follicle, tertiary follicle, and finally to the Graphian follicle, first the first hormone which is responsible is estrogen. Which hormone? Yes, number one, estrogen is supporting. Number two, FSH, that is follicular stimulating hormone. Okay? Yes. So finally, Graphian follicle is made. Now, once the Graphian follicle is produced, it has to rupture, it has to open. Right? It has to open. So this Graphian follicle will open out. It will open out, and from here the ovum will release. For this process to occur, for the rupturing of Graphian follicle, opening of the Graphian follicle and release of the ovum, here one more hormone is required, that is LH, luteinizing hormone. Done? Yes. So usually till 10th day, no, these two hormones will be supporting. From 12th to 14th day of the menstrual cycle, this LH surge will take place, means increase in the LH. Okay, increase in the LH hormone is called as LS surge. So that LS surge will lead to the release of ovum from the Graafian follicle. Rupturing of the Graafian follicle will take place and ovum will be released. When the ovum is released, the process is called ovulation. What it is called? It is called ovulation. Did you understand? Yes. Now that ovum which is released, right? So here till here, this process, complete process, is called as follicular phase that is happening in the ovary. Done? Yes. Coming to the third phase. Right? What is third phase? Ovulatory phase. No? So by the process of ovulation, the ovum has come out of the ovary. No? That ovum will be catched by the fimbriae. It will be catched by the fimbriae of the fallopian tube. From the fimbriae, it will move on to the infundibulum part. From the infundibulum part, it will reach the ampulla region. Okay? Ampulla region is a place where this ovum will be present for 24 hours to 48 hours. Okay? Ampulla is the region in the fallopian tubes where the ovum will be present for 24 hours, maximum 48 hours. Okay? At that time, if the insemination happens and the sperm reaches the ovum and fertilize, then it will lead to fertilization. Okay? If there is no fertilization in that time, no, what happens? This ovum starts degenerating. Okay? It starts degenerating and it will be discharged out. Done? Did you understand? This phase is called as ovulatory phase. Did you understand? Yes. Now when the ovulatory phase is over, at that time the endometrium layer which was shut down, again it is starting rebuilding again from one side. Okay? Reconstruction of the endometrium layer happens. Now what happens? Fourth one. After ovulatory phase, we have luteal phase, final phase. What is this luteal phase, sir? See, once the Graafian follicle ruptures and releases the ovum, no, after the ovum is released, we are not calling this as Graafian follicle. No, after the release of ovum, that follicle is not called as Graafian follicle. That will be called as, it will be called as corpus luteum. It will be called as corpus luteum, or another word we can use is, it is also called as yellow body. It is called yellow body. Why it is called yellow body, sir? Once the ovum is released, this structure which is called as corpus luteum or yellow body start producing the hormone called progesterone. Okay? And this progesterone hormone also called as pregnancy hormone. Yes, to confirm the pregnancy, this hormone will be released from the ovary. This hormone will go and attach the blastocyst. See, in the uterus part, when the ovum, after fertilization, when the ovum finally gets converted into blastocyst and reaches here. No? From one side, the endometrium layer will bind the ovum, blastocyst. Okay? From another side, it has to be binded. No? So during this phase, the progesterone hormone will come and bind like this. So once the attachment takes place, that is called as implantation. Attachment of the blastocyst to the endometrium layer of the uterus. So that is supported by progesterone hormone. Yes. Then finally implantation will take place, and implantation is the first step for pregnancy. Then see here, coming to the luteal phase, the luteal phase will not stop here. Again, if the progesterone hormone is utilized, it is utilized. Otherwise, again this luteal phase will start degenerating. Corpus luteum will again convert into new body by reducing in size. Okay? This is called corpus albicans. Okay? And this also called as white body. White body. So here this corpus albicans start degenerating, and at the day of 28 to 29 days, totally it will be degenerated. Once the degeneration of corpus albicans takes place, the luteal phase come to an end, menstrual cycle comes to an end, Again next day new menstrual cycle will start. Is it clear? Did you understand? Yes, four phases. Any doubts you have? No doubts? Clear? Yes, it is a 5 mark question. This question will be asked for 5 mark. Explain what is menstrual cycle in various cases. Any doubts? Either you have studied menstrual cycle, you studied MPP, STIS, and infertility. Yeah? Yes, all the topics are important for your upcoming test. Yes. Shall we stop here? Thank you very much. We'll start.